Radial nerve is a continuation of posterior cord of brachial plexus having all spinal roots from C5 to T1. It has sensory as well as motor component. Posterior compartment of arm, that is triceps, and posterior compartment of forearm, that is extensors and supinators, are supplied by the motor component. The sensory component of the radial nerve supplies posterior surface of forearm and dorsal side of lateral palm and lateral 3.5 digits. The radial nerve originates in the axilla behind the third part of the axillary artery in the front of subscapularis, latissimus dorsi, and teres major. It then passes through the medial and lateral heads of the triceps muscle, winding around the humerus through the radial groove and enters the forearm in front of the lateral epicondyle, giving branches to brachioradialis, brachialis, and extensor carpi radialis longus muscles. In the arm, it supplies triceps, anconeus, brachioradialis, extensor carpi radialis longus, and part of brachialis. At the elbow joint, it divides into superficial branch and deep branch. Superficial branch supplies the sensory supply to lateral 3.5 fingers on the dorsal aspect, and deep branch, which is also called posterior interosseous nerve, winds around the radius, supplying supinator and extensor carpi radialis brevis. In the arm, it passes with the deep brachial artery, that is profunda brachial artery, and gives two motor branches and one sensory branch before traversing the triangular interval. These motor branches innervate the medial and long heads of the triceps, and the sensory branch is called the posterior cutaneous nerve of the arm. After passing through the triangular interval, the radial nerve descends the radial groove, also called spiral groove, before laterally wrapping around the humerus. In this radial groove, the radial nerve gives a motor branch to the lateral head of the triceps brachii, followed by two sensory branches, that is the inferior lateral cutaneous nerve of the arm, which perforates through the lateral head of the triceps, and posterior cutaneous nerve of the forearm. As of now, the radial nerves in the posterior compartment of the arm. After giving these two sensory branches, the radial nerve passes through lateral intermuscular septum to get into anterior compartment of the forearm between the brachialis and brachioradialis muscles. The radial nerve then passes over the lateral epicondyle into the cubital fossa and forearm. Here, the radial nerve separates into deep and superficial branches. The deep branch is a motor branch that passes between the heads of the supinator muscle and becomes the posterior interosseous nerve to innervate the muscles of posterior compartment of the forearm. The superficial branch then travels dorsally over the distal radius over the anatomical snuff box to innervate the posterior lateral 3.5 digits, that is thumb, index, middle, and lateral half of the ring fingers. Radial neuropathies occur from injury to the radial nerve due to compression, ischemia, fractures to the arm, or penetrating wounds. Wrist drop is the most common presentation for radial nerve palsies. The severity of the neuropathy depends on the level of the injury. The radial nerve is affected in the axilla due to crutch palsy or the fracture of the upper end of the humerus. And in the radial groove, it is either due to pressure on the arm, Saturday night palsy, prolonged tourniquet application, or fracture of the shaft of the humerus. Saturday night palsy or honeymooner's palsy can occur after placing one's arm over a chair for an extended period, causing a pressure injury to the radial nerve. Radial nerve is affected at the elbow joint either due to dislocation or fracture neck of the radius. Radial nerve entrapment, which occurs due to compression of the radial nerve, is most common at the proximal forearm, where the posterior interosseous branch of the radial nerve passes between the supinator heads. Chiralgia paresthetica, also called Wartenberg syndrome, is a hand neuropathy commonly caused by trauma or compression of the superficial branch of the radial nerve. Posterior interosseous nerve is purely motor, so sensation is intact when it gets injured. Clinically, wrist drop presents as inability of extending the wrist or forearm or the thumb. Nerve suturing or nerve graft tendon transfer is the treatment of choice for wrist drop. Investigations being X-ray of the part or nerve conduction studies. Chiralgia paresthetica is associated with handcuff use, hence it is also referred to as handcuff neuropathy.